I'm Dr. Char, Director of Renew Skin and Health Clinic in Royal Leamington Spa. Today I have opportunity to meet Mr. Dan Higman, who is a consultant vascular surgeon as well as pediatric and general surgeon at Walsgrave Hospital in Coventry. Today we will talk about varicose veins in general, the surgical treatment, the medical treatment, etc. So Mr. Higman, tell me a little bit about the treatment options for varicose veins.
So really there are three main treatment options in terms of actually getting rid of your varicose veins. The first is surgery, which is a conventional approach, which would involve general anaesthetic and removing the varicose veins. Second is to foam inject the varicose veins, done under local anaesthetic. So that's a foam which goes into the vein and then makes the inside of the vein sort of sticky, and then you bandage the leg and that will close the vein off. And the third treatment is to, again under local anaesthetic, to pass a very fine tube into the vein and then seal the vein from the inside using a gentle heat. You can either use laser or microwave treatment, and that will seal the vein. So those are the three main treatments for varicose veins in terms of interventions.
So the inside of the veins are heated up,
Yes.
and they become sticky.
Yes, they just seal up as you heat them, either using microwaves or laser. My preference is to use microwaves because it's a gentler treatment and it's as effective as laser, but it's a gentler treatment, and I think the recovery from that is quicker and better.
Very good. And as a GP, I come across many patients who have got varicose veins, and all we do is to prescribe them these tight stockings to wear them up to the thigh, mid-thigh or upper thigh, but they don't ever settle down.
Well, compression stockings, properly measured and properly prescribed, will do a lot to relieve symptoms very often. The symptoms, the aching, the heaviness of varicose veins, so they will help a great deal. I think it's important to realise they will do nothing to get rid of your varicose veins. Your varicose veins will remain as they always are, even when you've got a stocking. And it also does nothing to prevent the development of varicose veins. So they really are just a symptomatic measure that a lot of patients do find beneficial, but it doesn't actually treat the varicose veins or get rid of them.
And the surgery, you said, how long the procedure takes, and what is the downtime after the procedure if you're doing any varicose vein procedure?
Well, I think that's really what is new and different about the treatment for varicose veins, because conventionally we would use surgery. Now surgery involves general anaesthetic in the hospital, in an operating theatre, and the patient will then have to recover from the anaesthetic. It's usually day case and they will go home the same day, but I think it's true to say that they will be perhaps off work for a week or two afterwards, not driving, rather limited in their mobility. So that's surgery. In terms of the other two treatments, the foam schlerotherapy and the microwave treatment, really that's a so-called office-based procedure. So the patient will come in, have that done and go home straight away. The expectation is that they would be back to work the next day. They would have minimal discomfort. For the foam sclerotherapy, they will have a bandage on their leg, so they have to carry on with that for a week. But it shouldn't restrict them in any great detail. They can drive and carry on with their normal activities. So the recovery from those type of treatments, is really very quick.
And after the surgical intervention, do they ever recur or come back?
Whichever treatment you have for varicose veins, about 70% of patients will be cured. In other words, they won't get any further varicose veins and their problem is sorted. But in about 30% of the population who've had treatment for varicose veins, they will get further veins in the future. Now that's not their veins coming back. That is them developing new varicose veins because they have a lot of normal veins in their legs still, and the normal disease process of developing varicose veins will continue throughout their life. So about 30% will get further varicose veins at some point, depending on how long you follow them up for.
And in the beginning of the discussion you said that wearing these stockings will obviously prevent the complications. And after the procedure, do they have to still wear these stockings?
And this is the key to successful treatment, if you've accurately diagnosed using ultrasound the site of their varicose veins and you've found out that actually their deep veins are functioning normally, but all their problems are related to superficial varicose veins, then having treated those varicose veins, they shouldn't have to wear stockings long term.
All right.
If, however, they have got varicose veins and their deep veins aren't working well, it may be that they have to wear long-term stockings. But for quite a lot of patients, their problems are purely in their varicose veins and their deep veins are fine. Those patients should manage without stockings afterwards.
Fantastic. So not very long downtime after the varicose vein surgery. Some procedures can be done in the office, and some other patients might require general anesthetic, and they all recover by 2 weeks or so, isn't it?
Yes, exactly. The various treatments, the quicker recoveries are with the so-called office-based, it's a treatment room, local anaesthetic procedures, and those will have rapid recovery, work and driving the next day usually. Surgery will have a more prolonged recovery. All three treatments are effective in treating varicose veins. The key thing is to tailor the treatment to the individual patient so that you get the right treatment for the right type of veins.
Good. One more question and last question. When you consult these patients, do you carry your ultrasound with you to diagnose the severity of their problem?
Yes, I have a portable duplex scanner, so it's a Doppler ultrasound, which means, in simple terms, it can actually see inside the leg and see the varicose veins, see the deep veins, and see exactly where they are. So a key point to the consultation, and in terms of deciding which treatment is going to be best for that patient, is to perform an ultrasound scan of the patient's leg, so you can clearly map out exactly where their varicose veins originate, and so that you can select the correct treatment for that patient to get to success.
And that is, at the end of the consultation, patient would know exactly and what procedure he's going to have.
Precisely. And I think that's the key.
That's fantastic. Well, thank you very much.
My pleasure.